and the complications given by filler. We have had 8 years of experience. We are going on the 9th now. It's almost 9 years. Sorry? Unfortunately, I don't have enough time to show you everything. I'm always optimistic, but so this is the case history that is not up to date. This is the case history up until last summer, and since that moment on, there were some more dozens of cases solved. I put the settings that we have generally, but these parameters are chosen according to the typical bureaucracy. Of course, we have the age group, and it is obvious that there will be more females than males presenting with this complication, and this distribution of materials, of fillers inserted in the faces of the persons. What is interesting is that there is an empirical classification. There are implants that are put here as endoprostheses. There are companies that put this stuff on the market. And there are some other implants that are infiltrated. The type of injecting them is by creating microdeposits distributed in the tissues. And obviously this already tells us that we have different approaches. Now, when we talk about this field, unfortunately, there are very few the persons who come without having been treated beforehand, and much more people who have received previous surgical interventions and attempts. But the tragedy is that there are treatments with corticosteroids, like 72% had previous steroid treatments, and half of the patients had previous surgical attempts to surgically remove. These are the areas. From time to time you have the gluteus or other sides of the body, but these are the main areas. How many sessions on average are necessary? 1.7 on average. This is a lie, in the sense that this is what the statistics show, but the majority of the cases with problems, let's say in one session we can't manage to remove the entire silicone deposit, but the inflammatory action shows us that the biggest part of the product is removed, and there are some cases who need 20 sessions, but they take cortisone for years. And we had patients who came because they were already devastated by osteoporosis, gastritis, and that, let's say, for 62% of the cases, there is a complete resolution of the problems, and in 1/3 of the cases, there is partial improvement that improves the quality of life of the patient. But if we want to be precise, not everything has disappeared, and 8% of the patients discontinue the treatment due to lack of satisfaction, or for example, there is the explanation that there is no magic wand, but some people don't accept this explanation. There are patients who come from other continents, and there is the problem of continuing the treatment for these, and one patient who unfortunately ended badly due to another a health problem, and 2 patients whom we've lost sight of. The complications are due mainly to swelling, although it is a microinvasive procedure, some scarring due to the fact that certain implants are intradermal, and when we go and evacuate the material, we don't have any dermis left. There are cases of recurrence and one hematoma and secondary sterile abscesses because after the treatment the patients should continue to squeeze at home the filler. Now before we start watching the video, I would want us to stand up because the next thing I want to say it while standing. So all these hundreds of patients, due to their daily problems, don't realize that they owe the regain of their health to Ovidio Marangoni. So he was the one who thought about connecting one of these fibers to the laser equipment and try to remove the material in order to cure the inflammation. Unfortunately, in 2006, we've talked about it, and I didn't know that he would leave us so prematurely. And I didn't have the opportunity to talk to him about this, but due to Francesco I continued his work, and now we can sit down. Thank you. Let's see the video. This is a patient whom had a filler injected. This is a patient from Cagliari. This is Silicone. But there was an enormous increase. Probably the silicone has obstructed some sebaceous glands. The smell is unique. Unfortunately, I cannot give you the sense of smell through the video. Unfortunately, I don't have images from before the intervention and after the intervention, but I can tell you that she improved drastically after the removal of the filler. As you can see, the fiber enters in the so-called granuloma. It's not a granuloma. You know that some terms are used improperly. Here also you have to know anatomy. It is done without anesthesia, but because you enter in the silicone in the fibrotic tissue and there is no sensitivity, but when the patient starts complaining because of the pain, it means that you went out of the area with the fiber. It's enough to see what comes out of that granuloma to understand that it's not a granuloma. And the complications given by the filler, these nodules, these sebaceous glands become cysts. It's a reaction not to the presence of the material, but it's a mechanical obstruction. And this video continues like this, but I think that you understand. Therefore, this is a slide to show you the first complication that I worked on in 2009 and see that the material is liquefied and the entire fibrotic tissue is liquefied as well, and in the following days it continues to get out together with the liquefied filler. And the complication, especially in the nasolabial area, generally generates pain in the lips as well. And there is an improvement, a cosmetic improvement as well. Now let's see. Okay, so ultrasound. Ultrasound may made in a center, in an office that knows how to make the ultrasound. There is one center in Rome and one in Milan. The one in Rome is almost sufficient and the one in Milan is sufficient. The one who learned how to perform them is a surgeon. First, he visits the patient and then makes the ultrasound and he knows how to explain what is inside. The other ones who perform ultrasound on patients write explanations as if they were judges or lawyers. You can't see, but that thing that is present there is not described. This is a cystic case. In order to correlate a bit the image, this is what you can see in ultrasound and in histological exam. This is the tissue with granulation and fibrosis. This is the product. There are no cellular part. Now, at this point, the role of biofilm in these cases of inflammation. In my opinion, the role of biofilm here is as if Galileo was explaining how the solar system is working, and he presented his theory, but the theory that the sun was still revolving around the earth was imposed on him. This is the same thing today when we talk about biofilm. How many dermatologists are present here in the room? Our colleagues, dermatologists, generally continue to deny the existence of biofilm. Why? Because in the culture you don't use it. It's not something that you should prove. You should first prove that it is not present and then start with corticosteroids. But the absence of evidence is not evidence of absence. Therefore, I believe that the majority of these complications are due to biofilm, and the proof that with adequate antibiotic, all of them improve. They can't be cured because biofilm cannot be cured with antibiotics, but if there was no component of bacterial problem, the antibiotic wouldn't have had any effect. But eliminating this should not be a thing to be discussed of in one's activity. In surgery, you can mutilate persons. The percentage of recurrence is 100% if you don't treat it well. In my opinion, it is very easy. The recurrence in the images is mandatory if you try to remove it with a scalpel. This is a case I treated with a vascular laser when I didn't know what I was doing. It's my first case, a very superficial case where the problem is this hypertrophy of telangiectasias. The vascular laser managed to solve the problem. There are cases in which there is no inflammation, and you can identify the product and you make a small incision. If you want to do it with the laser, there is no bleeding, therefore it is much easier to evacuate everything, to remove everything. This is a case. I showed you the histology of this case previously. Sometimes the patients don't squeeze enough at home, therefore some of the product will remain trapped inside. And this is that 30% of the cases, and this you've seen in histology. And what is important for the lips, you can't see in the photos that this is a normal lip that is soft and moves. Then article in North Europe is used, and now even the nurses can you can put this filler. Imagine what happens when all non-doctors will start performing these interventions. We already have so many complications from cases in which doctors treated the patients. Imagine what will happen after when nurses will apply it. This, from the point of view of the aspect, let's see, this is a case of bioalchemy. When the product is 6-7 years old, you manage to drain it. But afterwards, there is necrosis on the inside. And even if I perform incisions, you still need to go inside with laser fiber to eliminate fibrotic tissue as well. This is a patient that comes from abroad. She was deformed, and you can see what happens when the product was removed. Everything was swollen. I don't understand why they still keep using that. Silicone. What I wanted to show you is that especially with silicone, patients come after 10 years, 15 years, 20 years, and the tissue was completely deformed, expanded, and there is a reduction of the surrounding volumes due to age, and the entire swelling goes down. You can see the result after 3 treatments. It is still not very beautiful, but you can observe the improvement. And some other cases without the flesh, with the flesh. Look at this profile. It is not easy. It is important first not to create damages to the tissues. Secondly, the psychological dimension, because they have been through very rough periods. And thirdly, make the patient wait for at least 1 year before performing the treatment, because for the following 2-3 years it will be a spontaneous improvement. Other cases, this is a rhinoplasty. This probably is one of the worst cases I've had, and we start with this cortisone when you don't know what to do, but when you interrupt the cortisone, this is what happens. So these patients can be treated with a lot of patients with antibiotic at large spectrum, and some gastric protection and dairy ferments, and you have a 50% improvement. Silicone. You can see here the silicone that continued to come out, to be squeezed out, even at home. And you can see the difference. It's an unfortunate case, but you can see the difference. This is another case with Dermalive, and especially the area of the mouth was completely solved for this patient. And this is a patient with osteoporosis and all the problematics. This is lipofilling. The good news is that If you have faith in the famous biofilm, cases like this of Aquamid, and there are still people who believe that Aquamid is a good substance, without paying attention to the cleanliness, you get an infection. And this patient took for some weeks antibiotics. Unfortunately, she lives abroad, so she sent me the photos. You can see the plaston that was resorbed completely. Yes. Even here you can see the symptoms. After 2 weeks it has improved, and after 6 weeks the problem was completely solved. The important thing is to cure the tissues. Because if you work on the tissues, the antibiotic will start to penetrate. This is an old publication. Thank you for your attention.